Good evening, everyone. Sorry about the delay. Thanks so much for joining us this evening. The hour of 6 p.m. having arrived on this Monday, the 22nd of June, 2020, I will now call to order the City of Racine Common Council. The first item is to call the roll before we do Alder Tate. Were there any absences that you were informed of before the meeting began?
Yes, Alder Land and Alder Horton has to be excused.
Alder Horton is joining us audio, but not video, but he is on the line. With that, I will ask, I will unmute everybody and ask the clerk to please call the roll. Please call the roll.
Alder Coe. Alder Coe. Alder Jones.
Here.
Alder Tate II.
Present.
Alder Santiago Jr.
Present.
Alder Levy.
Present.
Alder Peterson.
Here.
Alder Horton.
Here.
Alder West.
Here.
Alder Young.
Here.
Alderwoman Glenn.
Here.
Alder Perez.
Present.
Alder Taft.
Here.
Alder Mi'kmaq.
Here.
Alder Lemke. Alder Lemke.
Here.
Thank you.
Great. All right, everyone, thank you very much. If everyone could please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Amen.
Apologies to everyone for the audible delay via WebEx on that, but I appreciate everyone's participation there. So we're going to get started. We have two items on the agenda tonight. I did have somebody who may ask, we did receive some public comments. Any public comments that we did receive by 4:30, the clerk has shared with members of the council, so please check your email for that communication. What we have before us is our two items. I will refer to Council President Alder Tate. Alder Tate, what we have before us is the Office of Mayor report. Do you have any items for separate consideration?
I actually haven't received any requests, but I'm sure we'll take this first one up separately. Item 0392-20, referral from Mayor Mason on behalf of co-sponsors Alders Mi'kmaq, Tate II, Horton, Taft, Lemke, Levy, Young, and Jones, requesting to adopt ordinance 0004-20, Safer Racine 2019 novel coronavirus response. Recommendation is to adopt the said ordinance. I move to approve.
Motion to approve the item. Alder Mi'kmaq, would you like to second the motion?
Second.
Thank you very much. Thank you very much for making the motion. Alder Tate, if it's okay with you, I'd like to, unless you want to speak to the motion right away, I was going to hand it over to the city attorney and the public health administrator just to give an overview of the item.
That's fine.
Great. Right? Listed as agree. Okay. Attorney Letney and Administrator Bowersox, are you able to hear us?
Yes.
Okay. So, Attorney Letney, if you could just give an overview on where we are procedurally here, and then I'm going to hand it over to Dottie Kay just to give an overview of the Safer Racine policy. Attorney Letney?
He might be muted under the column.
Oh, I'm sorry. I think Attorney Letney is not in the same room as Administrator Bowersox. Attorney Letney, are you able to hear us now?
Yes, Your Honor. Thank you.
Okay, please proceed.
Okay. So the matter before the Common Council is an ordinance change which would amend Chapter 54 of the Racine Municipal Code. Chapter 54, Article 2 deals with communicable diseases. Some of, as I indicated in an email I sent you, some of the changes that are proposed, parts 1, 2, 3, and 4, parts 1, 2, and 3 are just language cleanup, recognizing the fact that Chapter 143 of the Wisconsin statutes is now Chapter 252, and that the State Department of Health and Social Services is now the State Department of Health Services. The substantive sections are Part 4 and Part 5 of the ordinance that was on the agenda. Part 4 would create Section 54-33 of the ordinances. Section A would adopt the Safer Racine COVID-19 pandemic standards that were attached to the agenda and that were emailed to you. They would be adopted to the same extent as if they were actually set out fully verbatim in the ordinances, and they are to be published on the Racine website. Section B of 5433 would allow the public health administrator to make modifications as may be necessary based upon then current guidance from the World Health Organization, the Centers for Disease Control and Prevention, and the Wisconsin Department of Health Services, and then notify the Common Council of any modifications that are made. And then the last section, to some degree, subsection C is almost a sunset provision, but it requires the Common Council to readdress this entire issue no later than August 5th, which is the Common Council meeting that week. The public health administrator is required to provide the Common Council a full report regarding whatever's going on with the COVID-19 pandemic at that time, and then the Common Council shall take action either to extend, to modify, or to terminate the application of the standards that the Common Council would be adopting. Part 5 of the draft ordinance would create Section 5434 of the Municipal Code, which would provide for penalties for any person in violation of the prior section, and as drafted, it would provide a forfeiture of no more than $250. So this ordinance, if passed by the Common Council, would be actually fairly similar to any other ordinance the Common Council adopts. The City of Racine has a charter. The City of Racine has authority under the Wisconsin Constitution to engage in home rule and determine what is appropriate for the city, and the Common Council obviously makes those decisions. The bulk of this obviously is the Safer Racine COVID plan, and I think Dottie Kate can address those issues unless someone has questions for me right now.
I'm going to ask Dottie Kay to give her overview briefly, and then we'll hand it back over to Council President Tate to speak to his motion, and then we can begin the conversation from there. Dottie Kay Bowersox, could you please begin?
Oh, yes, thank you, Mayor. So it's been quite a ride. We've had 18 weeks now where we've been dealing with the pandemic, and it's just been exhausting for everyone who's been involved with it, all community members, all social service agencies, as well as any of the emergency responders, as well as it's been confusing. So we've had very little direction that has come from the federal government, very little direction from the Department of Health Services, because this is a pandemic. We have not been engaged in a pandemic for over 100 years, so there's no guidebook that was given to anyone about on Tuesday you go left and on Wednesday you go right. At the same point, a little over a month ago, we were getting, or we were receiving back of the tests that were taken for COVID, a 41% response rate of positive. We were inundated and overwhelmed. We were concerned about the hospital system, the one in particular that serves the city of Racine. At the same point, the police and fire response, how that was going to happen and what was going to happen with that, let alone within the public health department, how we were going to do the contact tracing and how we were going to notify individuals of positives, what education materials we were to give them, what information we were to provide them. That information today is still changing. As of this afternoon, we finally got some guidance from the Department of Health Services on the school systems, recommendations that they potentially are going to want to have to follow. At the same point, across the world, we're seeing increases in the COVID-19, as well as in the United States. We're still in the acceleration phase. We have 10 states, and I have Cody Pierce here with me, who's going to be talking about local numbers, and I have our epidemiologist, and I also have Bobby Fergus, who's the Director of Community Health, that's going to be talking about numbers in the nation and where we're going and what we're looking at. But again, the United States is still in the acceleration mode. The number of deaths has exceeded any of the expectations that any of the projections early on talked about. And at the same point, we don't want to go backwards, and that's why we're going forward. And it's been a good week. I can say that. I'm very proud of what we've done and how we've done it. And the Safer Racine provides some guidelines to keep us in that mode of going forward in a safe and in an appropriate manner.
Thank you, Dottie K, for that. I would just remind people, if you haven't seen it already, attached to the agenda is the Safer Racine plan, along with the proposed ordinance change and the language that Attorney Letney referenced. And so I would certainly encourage people, if you have not already, I'm sure you've all looked at it before we started, but if you need it for a reference point or have questions, please make those resources available to you. With that, I'm going to hand it back over to Council President Tate to speak to the motion.
Great, thank you. So the first thing I'll say is we weren't supposed to be here in this position. At the Racine Common Council, that is. There is a federal government with a large Center for Disease Control that is designed to deal with nationwide diseases and outbreaks. We have a state Department of Health and Human Services that locally in the state of Wisconsin is designed to deal with statewide illnesses and put those measures in place. Unfortunately, as mentioned, due to a lack of leadership at the federal level and disconnected leadership at the state level, both of those levels of government have failed in various ways to address this pandemic in a way that is uniform and is sensible and keeps people all on the same page. So after the Supreme Court's decision, we are here, which their decision was that the state Secretary of Health did not have the authority to put in the issues that she put. What the Supreme Court didn't say was that the existing public health officials didn't have the authority to do it. What their actual argument was at the time was that the state Department of Health Services director could not universally do it. It had to be done area by area, municipality by municipality, county by county. So they nullified that. Then, based off the Supreme Court's decision, the city of Racine adopted the existing Safer at Home order and maintained it. And then it let that sunset, and we, following our public health administrator, adopted additional measures to continue to maintain a steady and reasonable and deliberate way of dealing with this virus, but also opening our community safely. Then Friday, a local judge decided that the Supreme Court's decision wasn't sufficient in empowering local officials to do what they were designed to do in statute and removed it. That's why we're here today as a Common Council discussing the ordinance to put in place the protections that we have done very deliberately in the city of Racine to maintain some modicum of protection for our citizenry. But it shouldn't be in the Common Council's hands. These are not supposed to be political decisions. The Common Council is a political body. You know, we have different constituencies, different interests, business groups, individual groups, healthcare experts. Everyone's got a different opinion. And that's what we have to weigh in making decisions. But those are ultimately political decisions. The reason it's in the hands of the public health administrator in the first place is because that is a non-political entity. Their only job is to focus on the public health of the community and make recommendations, decisions, and orders associated with that. Because the judge made their decision, now it's up to the Common Council to again re-empower our public health administrator to make those decisions apolitically and away from the political process of, you know, constituents and various things, and have it based solely on the data, the science, and what ultimately best serves the health of our community. So that's why this is here in front of us in the first place, and it's important to put that in context. Also, what's in front of us is not more restrictions, it's not less restrictions than previously was in place. It's adopting the current standards that are there. So for the businesses who are worried if things are going to suddenly skyrocket, that's only based on what the data says in the community. Right now, as of Friday afternoon, it was 50% capacity for various places. After this, it will be 50% capacity for various places as applicable. And going forward, we're still going to use the data, which, as some have noted, is trending in a good direction to dial back those measures and ultimately open up further safely and reasonably our community. So I think just to frame the conversation, as we have this debate, which again shouldn't be the case, but here we are, as we frame it, we ought to frame it under the following. It's not a matter of whether you necessarily agree with the public health administrator. It's a matter of, do you want to be the choice between preventative measures and the absence of them as a Common Council? Because now it's in our hands. We have the choice to say, there's a pandemic facing our community. Our numbers, while trending positively, are some of the worst in the state. And we have the opportunity to say, what are we going to do about it? Because it's in our hands to say, what are we going to do about it? Are we going to allow our public administrator to make the science-based decisions to help maintain safety in the community? Or are we going to let things go free and let those chips fall where they may? And if we do, if those chips fall in a negative manner, then that's on us. If they fall positively, great, thank goodness. I'd much rather be cautious and do things more than were necessary than not do enough and have to deal with the reality of that. So with that, I'll yield the floor to others, but I'm speaking in favor of this motion. And I hope that as a Common Council, we will do what's necessary and, not make this a political thing, but make this a science and database thing, and allow our public health administrator to do her job and to continue to move things in a positive direction so that we can get to a place where every business can be open fully. We can be back in the parks and on the beach and everywhere we want to be, but because we can be there safely. Thank you.
Thank you, Alder Tate. Alder Mi'kmaq, you have the floor.
Thank you, Your Honor. I appreciate a few minutes to speak on this item. So I just want to start by saying that this is and never was going to be an easy situation to navigate. This whole situation has been wild and crazy and created difficult task after difficult task. The reality, however, tonight that this body faces is that we now must decide on what will serve and protect our entire community. Much like what Alder Tate was just saying, the situation we are forced into at this time. Where a business owner looks at it from their own perspective, their one perspective, we as this body need to look at this from many different perspectives and really be thoughtful about where we are and what we're trying to accomplish. While some business owners out there are truly trying to keep the best interest of their employees and customers in mind, we don't know that all of them are. While some citizens are truly trying to practice proper safety measures, others have abandoned the effort. There's no version of this where everyone is okay. We are tasked with finding a scenario where we get to choose, or where we get to try and find the most okay, or get to as okay as possible. The reality is the city has already invested in the sustainability of local businesses in the amount of $900,000. And just to point out, we were the first community in the state to do that, which is pretty significant. We are also later going to be voting on another amount of money to help with rental assistance for people that are struggling with issues related to COVID-19. The city has been working tirelessly, as Director Bowersox had said, to find answers and devise solutions to a pretty impossible situation. You know, I understand that this decision tonight is difficult, and a lot of you that are on council are struggling with this, I'm sure. Nothing about the last 4 months has been easy. And I'm willing to bet that the next 6 months are not going to be a whole lot easier. And I know none of us want to hear that, but that is the reality that we're facing. I see this ordinance that we're considering as providing a measure of guidance in an otherwise chaotic time. I also see it, as Alderman Tate pointed out, as a measure of prevention, which those of you who know me is kind of my bread and butter. So I really have to as often as possible get behind the measures of prevention, because it is a proven effective strategy in almost every situation. The reality is that no, not everyone is going to like this, and many are going to say it's not needed. We've heard that. We know that people are feeling that way. I believe that this is still the best path forward. We have seen decreasing infection rates over the last month. And while we cannot guarantee that it's because of this kind of an ordinance, it certainly has not hurt our situation. And lastly, I just want to point out that we are looking right now at about an 8-day window before this whole plan is reassessed and restrictions are likely lessened. I strongly encourage citizens to support all their local businesses in a safe and reasonable way, but we need to recognize that we didn't ask for this virus. We still have to deal with this virus. It's not over just because we're over it. I really think that this is the best path forward for us. I know this is a difficult decision, but I really, truly hope that all of you will support this ordinance tonight. Thank you.
Thank you, Alder Mietma. Alder Perez, you have the floor.
Thank you, Your Honor. I just have a couple of questions of what we received. So part of it has to do with just language changes in the statute or in the ordinance. And then a substantive change in section 5433. I'm wondering if this ordinance in particular could be split, or what we're looking at tonight could be split in that the language changes are done automatically, and then we discuss the Safer Racine policy. My problem with Safer Racine policy, or let me start off by saying, I totally understand where Alderman Mietma and Alderman Tate have come with this. I think their information is very valuable. I think the flip side to all this, even though Alderman Tate said that this is not political, it ends up being very political. And one of the questions that I have is in section B of section 5433, the Safer Racine plan. I understand from what I'm reading, and if I'm mistaken, please explain it to me, but we're not really taking the responsibility off of Ms. Bowersox, but we're actually giving it to council. And here, though, it says that the Common Council in section B grants the Public Health Administrator authority to modify the Safer Racine COVID-19 pandemic response standards as necessary to respond to the changing COVID-19 related public health conditions. I understand that. I'm a little bit troubled by that, in the sense that she is an appointed position. Even though she is very knowledgeable in her area, we should look at her recommendations and follow them if we can, but I don't think that that should be something legally that we should have authority over. I look at the Constitution and really look at this as overreach constitutionally, and that was mentioned before. And, you know, having and looking at other countries moving towards socialism, and coming myself from a communist country, we've come to a pretty slippery slope of what we can and can't do. I've always admired the Constitution. When I took a test to become a citizen of the United States of America, most of the questions were from the Constitution. And, you know, it was very important that you knew that as you moved into legal and responsible citizenship in the United States of America. Unfortunately, many people don't know it because they were born here. But if you weren't born here, you have to learn those things. And so coming from a communist country, I'm kind of troubled by what this says, giving power and authority to someone to change laws or regulations as they see fit with no real standard on one side or the other. And so we could one day say it's for one thing and the next day say it's for another based on the WHO recommendations and the Wisconsin Department of Health. So I'm troubled by that a little bit. So as I continue to look at this and I look at the standards, I see two parts here. I see the language change, which should be pro forma, and then actually the substance changes in the Safer Racine. And that's where I'm troubled. I've been contacted a lot by many community members all saying that, again, it comes around as looking to us like we're desperate. They're looking to us like it's overreach, from 24 hours and 16 minutes or whatever it was as a rule states that you got to have this out in 24 hours. Again, it looks like overreach. We were denied something on Friday and we're trying to make it right today. I get it that's important to do that, but again, it comes across as not being transparent. It comes across as desperate. Our community is hurting, and our community is saying in most of the papers that I've received, the phone calls and the emails, and they've said, look, we get this, there's a pandemic, and I have lost 5 friends that I've personally known to COVID. So I get it. I go outside, I wear my mask, I, distance myself. It's all very important. And so I understand that the measures are there, but I think we also have to take on personal responsibility. We as a council cannot be responsible for the decisions that people make with our community. We set guidelines and we set laws, and of course there's forfeitures and so forth. But we define what those laws are. And in the section 5433 Safer Racine, there's no definition of what those standards are. It's whatever the administrator thinks is appropriate at the time. And I think that's really pushing it. And I think we need to be real careful with that. If there were politicians and we're making laws, I get it. That's what we're tasked to do. That is part of our job. We are legislators in effect in what we do. And so I have a problem with that. And so my question was, can we bifurcate this to make it the pro forma language on one side and then vote on the Safer Racine part separately from that? Or do we have to do this all as one package? Could you please direct that to the city attorney and get an answer for me?
Sure, Alder Perez, I'll defer your procedural parliamentary question to the city attorney on, sorry, Adam.
Alder Perez, Mr. Mayor, thank you. What we call in our procedural rules is a division of the question, but essentially it's a bifurcation. If the Common Council, if anybody decides to make a motion to divide the question, bifurcate the question, that certainly is permissible.
Okay. Is it appropriate now to make a motion to bifurcate it, or do I have to wait till later in the discussion?
That's up to the chair.
So I can certainly assure you this, Alder Perez, we can come back to that. We have a lot of hands up. People would like to have a conversation about it. So I'd like to let people debate the entire motion as a whole, and then we can come back to your sorry, Adam, or division question as we get closer to the end. But we've got at least half a dozen hands up here.
Thank you.
So, thank you. Alder Young, you have the floor.
Thank you, Mr. Mayor. I have a series of questions, and I'm grateful for my colleagues for delivering their statements eloquently. But I have questions regarding data and process while we're looking to make this enormous decision. So my first question is for Director Bowersox, and that is, how impactful are these regulations considering our neighbors don't have any rules in place preventing the spread of COVID-19? And do we measure the effectiveness of our local ordinances, and how does that look in terms of collecting the data on public health?
Administrator Bowersox, if you're still there, if you could address Alder Young's question, please.
Sure, thank you, and good evening, Alder Young. So first off is the question in relationship to our neighbors. So Alder Tate had talked about the federal level and the state level, as well as the local level, and I really wish that we were all on the same page at the same time. Not having a guidebook, not having that sort of directive makes it very difficult for every jurisdiction. At the same point, every jurisdiction is very different. So our density numbers, our numbers of African Americans, Hispanics, the number of individuals that have access to health care, our Medicaid numbers, our free school lunch numbers are very different than any other jurisdiction. At the same point, we've seen it work very nicely here, as well as in the city of Milwaukee and Dane County, for taking recommendations and giving them to the community to be followed. So they've been very successful all three in 3 jurisdictions, as well as other jurisdictions across the country that have specifications and recommendations for activities as well as for businesses. Evaluating, we have our numbers that we take a look at on a daily basis. We take a look at the metrics on a daily basis in relationship to the SAFER Racine, as well as make sure that we understand the telephone calls that we get, the concerns that we get, and the responses that we provide.
Thank you, Patty K. Bowersox. Alder Young, did you have another question?
I do, yes. My next question relates to our next phase. As we've discussed, it seems like we're having success wrapping our arms around tackling this challenge. So what would you say the next phase of regulations looks like as we move forward?
Yeah, and what we've told the community, some of the jurisdictions have done a phased-in process that once you hit this metric, then you go to the next phase, and you hit these metrics, and you go to the next phase. The response that we got from the community, the concerns, is that a date is really important. So that's why we came up with the June 30th. We wanted the testing at Horlick High School to be completed. We also had some other testing within assisted living facilities that we wanted completed, so we could get that information back in, and that's how we came up with the June 30th timeline, which we'll be evaluating this week and reporting out.
Alder Young, did you have additional questions or comments?
Yes, one more question, and that is about how we change policy when we see that number of cases go down. When we talk about capacity in restaurants and we talk about large gatherings, when are we going to feel better about loosening those restrictions? At what point in the data do we say, all right, now we can make some progress and loosen, the expectations that we have for regulation?
Sure. Yeah, and within the SAFER Racine, we have a list of metrics in there, which I'm very proud to say at this point they're all green, so that's great. So we're looking at those, but then we also look at the recommendations from the WHO, the CDC, and DHS, and what they're recommending for local jurisdictions and for the populace.
Alder Young?
Thank you, Director. I appreciate your time.
Okay, next I will go to Alder Levy. Alder Levy, you have the floor.
Thank you, Your Honor. I wanted to ask about the penalties. I had some constituents reach out this afternoon asking specifically about what would warrant someone getting a penalty for violating an ordinance. So for folks who are currently watching us right now, I'm wondering if someone could give some examples of actions that would warrant someone getting a penalty for violating this ordinance.
I'll direct your question to Administrator Bowersox.
And thank you. Good evening, Alder. Within the framework of the SAFER Racine, the things that we would be taking a look at is individuals that were at a restaurant, for example, and they had, 200 people in the restaurant when they were only to be at 50% capacity based on occupancy.
Very good. Thank you, Director.
Okay. Alder Levy, any other comments, or is that?
No, that's it. Thank you.
Okay, great. Alder Lemke, you have the floor.
Thank you, Mr. Mayor. I appreciate the opportunity to discuss this issue, and I thank the Health Department staff for the updates that they provided. So today is a day that I don't think any of us thought would have come merely 6 months ago. And as I think back, as our nation sat poised to bid farewell to 2019 on December 31st, On that very day, the first cluster of pneumonia cases related to COVID was reported. And in our hometown, the city of Racine, as we looked ahead and planned for 2020, I don't think COVID would have reasonably been on any of our radars or planners. In my own life on December 31st, 2019, I was in the process of, in my day job, getting ready to welcome a new group of medical and public health students into the urban medicine program on the following Monday. On December 31st, I was making my typical start to the semester presentations, facilitating orientations at the hospital, checking the boxes, and preparing to welcome an eager group of medical students to study to become the doctors that will join our community here in Racine and in Wisconsin. Medical students are notorious for never leaving the clinic, be it early mornings, whether it's late nights helping to deliver the first baby of their career, or spending their weekends with the sickest members of our community on the inpatient wards. 6 months ago, I never would have imagined that all those dedicated students would be pulled from the clinics and hunkered down working to avoid getting COVID or spreading it. 6 months ago, I personally never would have imagined that I would have a friend pass away from COVID, who will certainly be missed. I imagine that all of us in Racine could say something similar. And at the outset of our year, I know my neighbors on the north side were preparing for their children to go to school after holiday break, saying goodbye to visiting family members after holidays, and planning for the return to regular and school and work routines. Those regular routines right now seem like a distant memory to us as a community, as we've seen churches move services online, grocery stores filled with customers donning masks, businesses moving to provide takeout and delivery services, and hospitals admitting our friends and neighbors with COVID pneumonia. There have been a number of challenges, despite the number of challenges in our own lives, and some bearing more than their share of the burden than others. I've been impressed by teachers creating drive-through celebrations of graduations, the janitors, first responders, food service workers, and medical staff working additional hours, and people just helping one another by wearing masks and taking personal responsibility. Now we're faced with a choice to continue in our community, and at the outset of the outbreak, one of our nation's leading infectious disease doctors, Dr. Anthony Fauci, reminded us that the disease is making the timeline. Right now, we are seeing levels of COVID cases dropping in Racine, and to continue this so that we don't have additional loss of life from our friends and neighbors, we have to decide whether or not we're going to support changing our way of life through the summer to help some of the most vulnerable members of our community, like the elders or people who've been immunocompromised with cancer or other illnesses. While this may be a difficult choice, I would ask that the members of the community support us as we work to continue safer Racine precautions. The city is committed to balancing health and the needs of businesses to remain open, and we've worked to find creative solutions, and as some have mentioned, scaled up over $900,000 in funds to local businesses, created the ability for businesses to do creative things like create sidewalk cafes, and are still looking at other solutions to help make sure that we keep things in balance in the city. That said, as we're faced with a choice here, in 6 months from now, I think we have the ability to either look at a place where we'll be able to say that we work to adapt as a community and struggle through the next 6 months to make sure that the most vulnerable in our community are healthy, or that we left things to chance and our city was left less whole as a result. And as a result, I'm going to support the continued safer Racine provisions. Thank you.
Thank you, Alder Lemke. Alder Glenn.
Thank you. I'm just making sure my dogs won't bark because I'm sitting outside. I apologize for that. I do have a couple questions that just came up. I am not unprepared, as Alderman Tate had called me out as being unprepared. I do have questions since listening to everything everybody said. And one thing that I really want to point out to everybody, we have a constitution to uphold. Our oath of office enforce. We promised that we would do that, and we need to do that. Alderman Meekma did mention that we're the first community to do this. Still doesn't make it right, because we're the first ones to do it. We have like other communities around us that are not abiding by anything that's unconstitutional, like what we're trying to push through tonight. I do have a few questions for Dottie K. Bowersox regarding the standards to reopen from from today, June 22nd and May 21st. That I do just have a questions. If I could please ask her those questions, greatly appreciate it.
Please proceed with your question, Alder Glenn.
Okay, my first question on here is right on the front page. Why have we eliminated on May 21st? The front page says a document produced for the city of Racine, villages of Wind Point in Elmwood Park. On today's Safer Racine, why have we eliminated villages of Wind Point in Elmwood Park?
Yes, yes, good afternoon, Alder. Oh,
Thank you.
yeah, good afternoon, Alder. This would be a City of Racine ordinance, and would not cover those two jurisdictions. Those two jurisdictions are covered by the Public Health Department, not by the city.
Okay, so we can, thank you, thank you. I'm gonna have to flip through my pages for my questions. Page 6. Okay, the one from, so this is all going along with the one from May 21st under where are we at today on page 6?
Okay, Alder, I don't have that document in front of me, so.
Okay, how about if I move to another one, forward Racine metric status, back from May 21st. You know, some of the statuses are marked with an X, meaning not good, but on the current one, they're all marked green. What is the difference between those red X's from the one from May and changing to green X's from the one from today? Under forward Racine metric status?
Please proceed, Dottie K.
Thank you, Mayor. So with that, Alder, these metrics are what we were looking at using as part of the decision on what the standards would be for the businesses and activities. So the red meant that we had a while to go, and the green means that we've met those.
Okay, so as of today's report, we've met all those that were
as of
set back
today's
in
report.
May.
Correct.
Okay. Thank you. It's just public health requirements, page 9. It states under there, all institutions and or businesses must follow the identified materials below for compliance with the emergency public health order. On today's one, it says compliance with the City of Racine ordinances, and that's just what, if this passes today, that is how we will enforce this, through an ordinance.
Yes, that is correct.
Okay, then on page 10, enforcement. This order is enforceable by the City of Racine Police Department and the City of Racine Public Health Department. Violations or obstructions of this order is punishable under the City of Racine Code of Ordinances. That is from May 21st. From the one I received today, this order is enforceable by the City of Racine Police Department and the City of Racine Health Department. Violations or obstructions of this order is punishable under the Racine Code of Ordinances. Really, how can this be enforced? I mean, is the police chief on with this?
Yes, so first and foremost, education is where we start. So to make sure that individuals understand what the perimeters are or what the request is or where they should be at within the activity. So the education is always first and foremost. Second from that, the enforceability again would be with the city police.
Okay, but however, wasn't that ruled on Friday, to be unenforceable?
The safer racine was not what was ruled on Friday.
Alder Glenn, if maybe I'll ask Attorney Letney to try to answer
Sure,
that
thank
last question
you.
for you. Attorney Letney, are you still there?
Yes, sir. Thank you, Mayor. Alder Glenn, the court's decision on Friday was based upon a different statutory section, specifically section 252.03. This proposed action is based upon a different legal standard.
So what standard are we basing this on now?
And if I can, Alder Glenn, I think we've heard this question a couple different ways, Attorney Letney. I think the question might be, as we're hearing people react to the decision on Friday, the question becomes that some might be asking is, does the city have the authority to pass this ordinance, even with what the decision was on Friday? I think what some people are wrestling with. I think Alder Young was asking that, and I think Alder Glenn seems to be asking it in a slightly different way. But I think people are wondering, does the city have the authority to pass an ordinance like this?
Thank you, Mr. Mayor, for that clarification. I want to make clear that the lawsuit that the court issued a ruling on Friday is still underway. It's still in active litigation. I clearly cannot and am not commenting on anything to do with that lawsuit. The city does have the authority to enact ordinances that the Common Council believes are in the best interest of the city, based upon general constitutional principles, home rule, the city's charter, and generally the laws in the state of Wisconsin. As I say, this is a different legal basis than anything that was at issue in the lawsuit where there was a decision on Friday. So, I mean, the short answer is yes, the city has the lawful authority to enact an ordinance like this.
Okay, got 3 more questions and I'll be done. And why are we pushing this through so fast if this current lawsuit is not completed? You know, it's not been ruled upon. Why are we pushing this forward right now? Because we don't really know the true outcome.
Well, the court did issue an injunction which prevents the city and the public health administrator from enforcing any general order that is based upon statutory section 252.03. So that injunction is in place. Yes, the lawsuit is still going, but the court has said that orders under that particular statutory section are not enforceable.
Okay, thank you.
Yeah, 2 more
Thank
questions.
you. Does this also, I mean, this ordinance, are we giving Ms. Bowersox limitless power? Or is there, what kind of limits are going to be set on this? Or like I said, is it just limitless?
Attorney Letney?
Yeah, the standards, first of all, in 5433A, the standards that are in the Safer Racine plan that you have before you, which establish certain standards as of June 22nd and indicate a review will exist on June 30th. Those are the standards that is what you would be telling the public health administrator to enforce. Section B, as has been pointed out before, does allow the public health administrator to modify the standards which may be necessary based upon the guidance from the World Health Organization, the Centers for Disease Control and Prevention, and the Wisconsin Department of Health Services. So I would not characterize those as limitless. You would be, if the Common Council approves this ordinance, allowing the public health administrator to make modifications based upon whatever is going on in that moment with regard to the COVID-19 public health conditions. And then, of course, she would have to notify the Common Council in writing within 5 days. And then whatever else happens between now and August 5th, the public health administrator will be required to report to the Common Council under the proposed 5433C, and the Common Council at that moment can, actually says shall, take action to extend, modify, or terminate. So it's completely up to the Common Council. And I should say, there is nothing in this ordinance that would not prevent the Common Council, if it deemed appropriate, to take earlier action for August 5th, if the Common Council deemed it appropriate.
Glenn, you have one more
Okay,
question?
yes, if I can ask Ms. Bowersox just one more question. Just real quick, what is the total percentage of positive cases per the city of Racine, like its population? What does that percentage come out to be as? If, let's just say we just guesstimate 75,000 people per the positive test, what is the percentage of that?
How many people have been tested?
13% of tests have been positive.
I'm sorry, say that again.
So 13% of tests have been positive. Is that what she's asking?
Yeah, and Alder, I think I'm understanding the question, but 13.5% of our tests have come back positive.
And how does that compare to the
average.
population of the city of Racine? What's that percentage versus the population of city of Racine to those testing positive? Is it 13% or is it 1%?
It appears to be about 1.8%.
Thank you, Mr. Palanik. I'm done for now. I'm done. Thank you very much, everyone, for answering my questions. I greatly appreciate it.
Thanks, Alder Glenn. Alder Taft, you have the floor.
Thank you. I think that this is an important discussion to have, and I appreciate all the comments from my colleagues. What I'll say is that I think we need to look at what the science is telling us, and the Public Health Administration, their whole job of the entire Public Health Administration is to use the data that is available to them and their experience and their training to make decisions about what is safe for our community. I think the city has demonstrated very clearly its commitment to the sustainability of small business. That Alder Mikwa was the one that made it clear that we were the first to do that, to offer these forgivable loans and other aid to small businesses. We're taking small business very seriously. I also think that a couple clarifications need to be made. I am curious. I believe that legally, the laws of the country, the Constitution, the laws of the state, the laws of our city empower us to pass this ordinance if we deem it appropriate. This is completely legal, and this is now I wish there was more leadership at the federal level. I wish there hadn't been partisan games at the state level that left us with no plan and chaos. I think the responsible thing for our city to do is to look at the evidence and look at the data, and we are a hotspot in our state for this pandemic, and it is our responsibility to keep our citizens safe. And that is exactly what the Public Health Department, we are empowering the Public Health Department to do. These powers are not limitless. They have to be justified by the guidelines put forth in the World Health Organization, the Center for Disease Control, the Wisconsin Department of Health Services. It sunsets August 5th. If we deem these excessive, we could come in at any time and change this ordinance. So we as Common Council have power to do this. But I think the responsible thing for us as a Common Council to do is to empower our Public Health Administration to use the data to make these decisions. the reason that we're extending this, I mean, I understand about the metrics being green right now, and that may seem that to many that we should be lifting all restrictions. However, we need to continue to empower the public health administrator to monitor and change the guidelines in response to changes in the number of cases in the pandemic. So by allowing the public health administrator to modify these changes through August 15th, it allows us to respond quickly and to these restrictions, to the cases. So if we have a sudden spike in cases, we may need to tighten up restrictions, and the public health administration is absolutely the best entity of our government to be making those decisions. And we are serving as oversight. We will continue to serve as oversight. I think this is an example of us acting in an oversight way. I think it's come up a couple times. Why are we doing this so quickly? We wouldn't have to do this if the ruling on Friday didn't make this necessary. It is our responsibility to protect our citizens and our community. And that's why we have to respond quickly. There's no other reason for it than that. We are trying to respond quickly as possible to situations that are on the ground. So I think I fully support this ordinance because it gives the city council oversight into making these, into the public health administrator. It empowers the public health administrator to use the science, to use the data, to make these decisions. And we can continue, as we have as a city, to think about ways that we can lessen the impact on our community and small businesses. This is really important. I've heard from many businesses. Last thing I'll say is I've heard from many businesses that say, well, we're going to do these restrictions already. So why do you need to legislate it? And it's like, if you're going to do the restrictions already, that's great. You shouldn't have a problem with this ordinance because you're already doing what you're supposed to be doing. Going along with recommendations, that's fantastic. Keep doing what you're doing. I think I'm very happy to see the way our communities come together and worn masks and done social distancing and protect each other. And I'd like to see that continue for as long as it's necessary. So I think this gives us the flexibility we need to respond to the pandemic quickly and using sound data and sound science. Thank you.
Thank you, Alder Taft. Alder Young, your hand is still up. Did you have other comments or questions?
Not at this time.
Okay. Alder Meekma, your hand is still up. Did you have other comments?
No, not at this time. Sorry.
Okay. Alder Peterson, I see your hand up just recently. Do you have comments or questions?
Yes, I thought I had it up. That was a mistake on me. Thank you. Couple questions for Ms. Bowersox. One, how many active cases do we have in the city, being that the number we keep hearing is 1477 or whatever that is? Two, what's taken place in Mount Pleasant, Caledonia, and the rest of the county as they have loose restrictions? They've requested restrictions but not enforced them. Have their numbers increased, decreased?
Dottie K. Bowersox, can you address those questions, please?
Yes, I can. Thank you, Alder. Number of active cases, Jody?
312.
We have 312 active cases today in the city of Racine.
Thank you.
Okay.
As far as the county, how have they been doing since they've made suggestions but not requirements for following guidelines?
County only.
Yeah, I don't have the county only numbers, Alder. I do know that their cases or their numbers have been going down, but I don't have specific numbers for them here.
Okay. I guess for me, this is more of a reason why we should have a countywide health department going forward. I find it's different. Isolate the city in this process. We have people that come in from outside Mount Pleasant, Caledonia, come into the city residents going outside, going to the beer gardens, going to their bars. I don't think that this can be done ad hoc, and I understand it is a political thing. Their health department thinks differently than our health department, or their politicians think differently than our politicians. Question for Mr. Letney. without getting into specifics, what is the time frame for forward action with Friday's ruling?
Thank you, Alderman. The court has ordered a final hearing on the declaratory judgment action to be held this Friday at 1:30 p.m.
Thank you very much, Mr. Litney. See, that's problematic for me. I'd rather see and wait till then. I don't see this pandemic flying through the roof in a week's time. Like I was talking to the mayor earlier, perception is everything. Image is everything. Right now, the public looks like this is a Sunday night massacre kind of thing. I'm not going to a bar. I'm not going anywhere. Everybody I know is following the restrictions. And it's not going to change whether or not we are enforcing them for a week. I personally would like to wait and see the legal action play out and take it from there. To me, I don't want to make it political, and at this point, it is political. So, like I said, the city has a different politics than the county, and we have different rules as a result. So, for that reason, I personally will be voting no, just because I'd rather let the legal system play out. And it's a short time frame. Things aren't going to go through the roof in 5 days. So, we can always revisit it once the court makes its final decision. Thank you.
Thank you. Alder Lemke, your hand is raised again.
Thank you. I appreciate it, Mr. Chair. I want to point out that as recently as 2 weeks ago, in the beginning of June, the city of Racine had 29.5 deaths per 100,000 people. So, just saying 5 people or what have you doesn't have as much meaning as looking at deaths per 100,000 people, where we compare it across communities in our whole state. And at that point, that was approximately the second highest in the state. That's why people were calling Racine a hotspot. And because of the actions that we're taking, because of whether it's careful, safer Racine policies, or whether it's people who are, being thoughtful of their neighbors and wearing masks, because of that, in 2 weeks' time, we've been able to start seeing some of these indicators hit more green lights, and or green check boxes, if you will. And because of that, the city health administrator has, been able to ease some of the restrictions that were in existence. And I want to, point to people that there's these sort of gate criteria or what have you that allows people in our health department to not just tighten restrictions, but to loosen them when it makes sense. And that we do have in June and proposed in August checkpoints built in to see whether things are, changing, and that we can come back sooner if the data would show us that it's necessary. So I think it's important to point those things out. And I think part of the problem with waiting for the courts is we could wait 5 days, but then there's going to be, my specialty is not legal affairs. It's, it's health. And there's going to be an appeal probably, and an appeal on the appeal, and some new actions. And these things drag out for months. And the problem is the virus isn't not going to stop and say, well, we're waiting for the court battles to hash out, whether it's in our county or whether it moves up and, goes higher than that. And I think that that's part of the problem. And so for that reason, the realities haven't changed. So I'll be supporting this.
Thank you, Alder Lemke. Alder Tate.
Thank you, Mr. Mayor. I think these are great questions from my aldermanic colleagues, coming from every which direction. They're fair. And the reason it's political is, again, because it's among a political body now. It wasn't prior to Friday. It was within the hands of our public health administrator, who doesn't care about politics, just the data, just the science, and just the public health. It's been political throughout this process. Fortunately for the city, at various other levels of the government, we've tried to keep it non-political and keep it in the hands of our public health administrator. Now it is wholly political because it's in this common council's body. So I know earlier, and it's been touched on a few times, that Alder Perez and several others kind of asked what's the standard that the Director Bowersox will have to adhere to, as noted in Ordinance 50, Section 55-33, Section B. The standards will be those of the State Department of Health, the Center for Disease Control and Prevention, and the World Health Organization. As we don't have the capacity to assess, crunch all the data numbers as much as these larger organizations are seeing the larger trends operate, but we do have our small slice within the city that we're able to monitor and understand how that's moving and how it's working, and what the other virologists are discovering about this disease also. I know a couple things that I'd like to ask Director Bowersox, or at least hopefully she can address, relate to the previous order that was in place under her authority as the public health administrator versus what we're proposing today. One of which is, we see the check boxes where we hit a lot of gating criteria. We've got, green lights across the board. What is the rationale for waiting until June 3rd to making those particular amendments and new recommendations, potentially lessening the restrictions that exist, as opposed to implementing those today? I would like the administrator to speak to that.
Oh, yes.
Administrator Bowersox?
Oh, thank you, Mayor, and thank you, Alder. Yes, the June 30th, again, was a timeline through our discussions and our comments from many individuals. The phase-in process didn't have enough specificity with it. It's like you were going to go to phase 2 or phase 3 or phase 4, whatever the other jurisdictions were doing, but it didn't have a date on it. It didn't have a timeline. So when we were taking a look at June 30th as being a reporting out timeline, we had testing at Horlick. Again, we had testing at assisted care living facilities. We wanted to wait till that information was coming back, as well as we wanted to get information from individuals from activities and businesses about their perspectives. And they've been very good about sending information over to us, having conversation with us. But again, we'll be looking at national trends as well as local trends this week with information for the June 30th timeline. But again, we're still collecting information and collecting data.
Okay, so to be clear, the June 30th date was identified in consultation with the local business community. Is that what you're saying?
No, the June 30th was a date that was determined based on a date versus the phases, because we'd heard from the local community that they didn't like the phase because there wasn't a specific date that was associated with it. So the June 30th was determined by the Public Health Department based on testing and also the timelines of where we were at the time the date was chosen.
Okay, so to be clear, choosing a date as opposed to acting on the data when it reflected certain things was in response to some requests from the business community. Is that accurate?
Yes.
Okay, great. So I think that's important to consider, that, again, the city isn't operating in a vacuum, neither is the Public Health Department, but even the very way that we're taking on this data, interpreting it, and then applying it is in consultation with various segments of the community, such as we just heard, we're operating not from strictly a gating criterion says when we meet X, we automatically do Y. It's we're going to roll out at this particular date because from the business community and others said we'd rather know a date than kind of get sprung on us based on what the data says. I think that's reflective of what this process has been, or at least should be more of, is with consultation and kind of trying to be as transparent and open and acknowledging of what's happening within the community. Another comment I have is, and potentially introducing an amendment if no others have questions, but in section B, it does say notifying the Common Council within 5 days. Given that this is a fast-moving virus, given that the shifts in what we're seeing may require a response more swiftly, I'm not necessarily comfortable with having a 5-day period be elapsed prior to getting that notification, but I think I'd rather see something between 24 and 48 hours notice, 48-hour notice, even if that includes the weekend, because if things are going to change, I think it's important that the Common Council has the opportunity to see what those things are so that we can disseminate that information to our communities, and not just kind of through a press release through the Journal Times or on the website. So that will be something as we continue this dialogue that I'll be moving to amend, not now, because others may be in the queue to discuss this, but I think that's worth addressing. So it may have been touched on earlier, but I do want it reiterated. Based on where we are now, the numbers that we're looking at, what might be anticipated in terms of what comes out on June 30th? If things remain on track, what do you think would be an example of some potential changes that might come?
Thank you, Alder. So again, taking a look at the metrics with this. So right now, as I've mentioned, we're at the 2% as far as the positives. But at the same point, last week we were at 10%, we were at 7%, we were at 8%. So as we take a look at that, that percent is based on the number of testing or the number of individuals that have gotten tested and those results that we get back. The testing has been gone down, the number of individuals that are being requested to be tested. At the same point, over the course of this pandemic, the alterations on who can get tested, when they can get tested, and how they can get tested has changed on a regular basis. We went to tiers and ABCs, and then we went to 1, 2, 3, and then we just went to categories. And so again, it's changed on a frequent basis. At the same point, several weeks ago, it was determined that there was enough supplies that were in the state of Wisconsin so everyone could get tested whether they were symptomatic or non-symptomatic. And so that opened up the floodgates for everyone again to get tested. So we anticipate or we expect or that we project that the number is actually higher because we're allowing everyone to get tested versus those individuals that are simply symptomatic. So at the same point, when we take a look at where we are today, realizing that we've got a lot of numbers from our testing site that we probably will not get back until Wednesday of this week into Thursday of this week, anticipating that we will have a relaxation on a lot of those different activities, an increase in the number of mass gatherings, and just an increase in the capacity of organizations to have individuals in their facilities. Again, with the clear understanding that the 6-foot physical or social distancing would be following, that they would wear masks as appropriate, the touch points would be cleaned on a regular basis, the bathrooms, the railings, those type of things, that they would follow those guidelines. If you're ill, you stay home, and that they monitor, staff and employees as well as themselves for activities in their places of business.
So kind of to summarize that, to be clear, if the data continues to progress in the way that it is and our gating criteria continues to be met in the way that it is, we can expect on June 30th some recommendations for relaxing some of the restrictions that are in place.
That is correct.
Okay, thank you.
Alder Coe.
Yeah, first I have a couple questions for Dottie K, then I have a statement to make. How effective is this ordinance when people outside of Racine with no restrictions go to our businesses here in Racine? And how do we keep track of this?
Dottie K. Bowersox, could you respond to those questions, please?
Oh, yes. Thank you, Alder. I do not have a tracking mechanism to find out how many other individuals are coming into the jurisdiction that don't live here, or I don't have a tracking mechanism to do that.
Alder Coe?
Well, so how effective is our ordinance when people outside of Racine go to our businesses with no restrictions? We don't know if people outside going to places with no restrictions at all are coming here, could be causing this, and we should be able to have a way to track this.
Yes, I can't answer that. That's a tracking question for you. I can, though, for those businesses, when they come from outside of this area and they come into our businesses, there's specifications on occupancy and how many individuals can be within those establishments, the 6-foot social distancing or physical distancing.
All right, and I got a statement. So I've been struggling with how I was going to vote on this for the last couple of days. I feel like we're on the island of misfit toys. I do feel that Dottie K and Mayor Mason are doing what they think is best for the city in the purview of their respected roles. I, in my understanding of my respected role, must do the same. Over the last couple of days, I've talked with individuals and businesses owners in the city. It has come to my attention people who live here are going outside of the city for events and the like. I don't want people to lose interest or motivation to come here. We're losing venues for wedding receptions, venues for outdoor events that would bring money into the community. Recently, the zoo had a fundraiser and they ended up having it in Caledonia, and a local caterer lost $5,000 on this event. I know more than anyone else this COVID-19 is no joke. I had it. I don't wish for anyone else to contract it, nor do I believe that any of our businesses wish this fate on anyone. We have to trust in our business owners to do the right thing to keep their customers safe. We trusted them enough to have them be part of our community. We can't take away that trust now. Thank you.
Thank you, Alder Coe. Alder Perez?
Thank you, Your Honor. Another aspect of this, and it's bothersome to me as a law enforcement officer, we're not only officers of the city, but we are legislators. We make the laws. And in the past, in the recent past, we voted on ordinances which had the effect of law, and resolutions which also have the effect of law, where we didn't have all the complete information. Now we're voting on something today that doesn't have a time point in this sense. If you're an officer and you want to enforce a law, the law is this today and different tomorrow. Makes it really tough on the persons who are enforcing the law because there is no standard. We can't go to, Wisconsin state standard, blah, 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 or ordinance 343.5.6 A, B, and C and charge someone with a crime when there is no such crime listed there. And I think that puts an undue burden on our law enforcement. Like I said, maintain the regulations. They're good. They're good for us. We've done it. It makes us a safer community. But we impose these. It not only hurts us economically, it helps us. It hurts us as a community. Our businesses are hurting because of it. Our people are hurting because of it. Our people are getting sick when they're not following the recommendations. But that's not really something that we enforce. We should have this compliance that we request and give a little responsibility to our people and say, look, you have to follow the rules. If you don't follow the rules, you're at risk. And then there's a chance of, a problem, getting hurt, dying, getting the pneumonia, whatever it is. I find it really difficult for me as a legislator in this body to approve of a law that has no standard. As Alderman Tate said, it changes. Look at what the standard and who it says today, the WHO, and what it says tomorrow. It could be totally different. And so we've seen that in the recent past. So I think we have to be real careful as we move forward. We're hurting our community economically. We're hurting our community morally. I mean, people are losing their businesses. We're hurting our tax base, and we're not giving people their ability to make choices, good choices, we hope always. Unfortunately, I know that's not true. But I think that's one aspect of what we do as legislators that has to be important to us. When we vote a law in, we need to be specific. It has to have specifics. It cannot be vague. It's not fair to us. It's not fair to our attorney that has to defend our laws. It's not fair to the community that has to follow it because it's vague. There's no specific time point in it. And so that's one aspect of this whole thing that's bothersome. The fact that I believe some comments were made earlier online, and then some comments about where we're going with this and how the judge's ruling affected everything. But we don't need to call names. We need to look at the Constitution. We need to look at what it says. We need to look at our own Constitution. Yes, we're lawmakers. Let's make laws. Let's not make vague laws. Let's make specific laws. Let's keep our city as a priority. Okay. Let's keep our people as a priority. And some of these things that we're trying to implement today are really not doing that. They might give that appearance on the outside, but they're taking away individual freedoms. They're taking away business freedoms. They're taking away the inability of our businesses to function within our community, even when they are abiding by our safe, Racine standards and guidelines. So as I look at this question that we have before us today, I'd encourage you to consider all those things that have been said today. They've all been very good. Everyone has made really solid points. But we have to make calls based on how we represent our constituencies. We have to make calls on what we believe. And as we move forward, I don't think this is the right choice for us right now. I really think we need to vote no on this. We can bifurcate the question and just vote on the language of the first part, which is going to have to change anyway because it's what the state law says. But when we come to the Safer Racine section 5433 A, B, and C, we really can't go there. I mean, really think this through. As they've said, as our speakers have said today, our fellow, our peers, our fellow alderpersons, our representatives in the community, yeah, a lot of things going on. We get it. A lot of ways to look at this. We get it. But what responsibility do we have as alders representing the city and representing our constituency to protect all their interests, their health, their business, their ability to make choices, the freedoms that come with being a citizen or a resident of the United States of America, and particularly the city of Racine. I love the city of Racine. It's amazing. I mean, I moved here from Miami 16 years ago, and I don't want to go back to Miami. I love this place. But I see us having to move forward and looking at this. This is not the right way to do it, my friends. Really consider what I'm saying and vote no for this aspect of it. Thank you.
Thank you, Alder Perez. Alder Glenn?
Hi, thank you. I just have one more question regarding the fines. Kind of seems when Ms. Boxauer, sorry, I had to mispronounce your name. She said local businesses like bars and restaurants, that's what they're going to concentrate on fining people at. So this whole thing kind of seems to me, as per her answer to the question, we're going to put this on their backs. I mean, I heard nothing about the protests, the rallies. Are we going to be fining those people also, or is it just people in small businesses? If someone could please answer that for me.
Administrator Bowersox, if you could please try to address Alder Glenn's question, please.
Sure. And again, first and foremost, education is where we start, whether it be within the police department or the health department. That's where we start. So we want to make sure that individuals understand. At the same point, that was an example that I utilized, but it would be an activity and/or a business that would be outside the perimeters of that knew what the standards were and decided to make a conscious effort not to comply. Then there would be a possibility of that.
Okay, and once again, you're saying businesses. What about the general public outside for these things? I mean, some of these rallies, protests are good things. I mean, they are very good things, but are we going to start fining them should any of these rallies or protests or, city, residents coming together? Is there a possibility of them also being fined?
Well, that'll be up to the police department on how they would like to handle that.
Okay, so okay, thank you very much for answering that. All I just have to say is that's not really a true answer. We are not getting true answers about this to vote yes on this. I mean, we can't even give our citizens of the city of Racine the opportunity to show one another that each of our lives value, and we're going to take this very seriously and not run around and into big crowds. And, we need to have courage to let our citizens prove to us that they can do this, and they are going to do this. Most that I have talked to, unbelievable amount of people I talked to have reported that I'm not going to go out there and run around and be amongst big people. If I want to do that, I'd be shopping at Walmart or I'd be shopping at Menards. They're not, a lot of people aren't doing that. And I bet you if you go and you see that, there's decline there in their profits because of this. Can you imagine what our small businesses are going through? We're putting too much of this on the backs of our small business. Each and every one of us needs to follow the Constitution. This is political. It is a power grab, and we need to stop this right now. I'm voting no on this because that is the right thing to do right now. If we can show we trust our citizens, we're going to go a long way with this, with more negative test results and everything. We have to show them we trust on that and that they're going to do the right thing. Thank you.
Thank you, Alder Glenn. Alder Taft?
Guys, pause. Hi. Okay, I just had a couple more comments. I appreciate this dialogue. I wanted to emphasize that these are really unusual times, and lifting restrictions is not going to somehow make people go back to normal. Is not going to make things normal. As Alder Glenn just mentioned, many people are staying home of their own volition. So it's not restrictions alone that are hurting these businesses. People are going to be making decisions to avoid large crowds. They're not spending the way they used to be. They're not going out to dinner. They're not going out to public gatherings. And so this is, it's not the restrictions alone that are hurting businesses. Businesses are going to be hurting regardless of these restrictions. But these restrictions can help keep people safe, and that's very important. We can continue to, we have, as far as Alder Perez's question about thinking about what our responsibility is, I too am thinking very carefully about what my responsibility is as an older person and my responsibility to keeping my community safe. And that's sort of where I come down on this, is that it's my responsibility to do whatever I can to keep our most vulnerable citizens safe, our workers safe, everybody as safe as possible. I do think that I'm interested in, well, I'm not sure I want to go down this route, but I mean, people who are talking about the Constitution, I would be interested in the specifics of what specifically violates the Constitution. And many businesses say no shirt, no shoes, no service. Nobody loses their mind, and nobody, says, oh, this is unconstitutional. These are restrictions are important. Workers have to wash their hands. You have to wash your hands when you go to a business. That's not unconstitutional. This is the same thing. I also trust our law enforcement to respond to unusual and uncertain circumstances. Rapid changes happen, and this is a pandemic, and this is something that's unusual. This is something that we haven't seen for 100 years. I certainly have confidence that our law enforcement can respond to changing restrictions as needed. I don't think we're, as a city, we've been pretty consistent in not change. We've only had to change things in response to outside forces. More than that. So I think that in my consideration of what my responsibility is as an older person, as a person who is responsible for people, that we have to do everything we can to keep folks safe. Thank you. I support this. Thank you so much.
Thank you. Alder Tate, you have the floor.
Yes, I move to the previous question.
Okay. Alder Tate has called the question. The clerk, I want to open.
I think that requires a second and a vote.
Is there a second to call the question, Alder Taft?
Second.
Okay. All those in favor of calling the question, please say aye.
Aye.
Opposed? The ayes have it. The clerk will call the roll. I'm going to unmute everybody. Please, please try to avoid the feedback. Go ahead.
Alder Lemke? Alder Coe?
No.
Alder Jones? Alder Jones? Alder Tate the second?
Aye.
Alder Santiago Jr.? Alder Santiago?
Your head.
You hear me?
There's too much feedback to hear. I'm actually going to mute everybody and unmute you as she calls your name. All right. Alder Santiago?
No.
Okay.
Alder Levy?
Alder Levy?
Aye.
Alder Peterson?
Oh,
Alder Peterson?
no.
Horton.
Get to the. Alder Horton?
Aye. Alder West.
Alder West?
Aye.
Alder Young.
Alder Young?
Aye.
Alderwoman Glenn.
Alder Glenn?
Can you tell us what we're voting on right now? You didn't specifically say that when you opened the roll.
We are voting on item 0392-20.
No.
Alder Perez.
Alder Perez?
No.
Alder Taft.
Alder Taft?
Yes.
Alder Meekma.
Alder Meekma?
Yes.
And back to Alder Jones.
Alder Jones? Alder Jones, are you there? Alder Jones, we cannot hear you right now. Oh, Alder Jones? An icon showed up saying that you were speaking, but we cannot hear you right now. Alder Jones? Again, the icon says that you are speaking. I cannot tell. Cannot tell your answer. Alder Jones, your icon again is appearing that you're speaking, but we can't hear you at all.
Can I make a suggestion? This is Alder Lemke.
Yeah, please.
If you, I don't know if it pertains, but if you go to communicate on the top of the bar and then go to speaker, microphone, and camera, just make sure that it's set up to be your, that everything's set up to be communicating through your computer. I don't know if that will help.
So Alder Jones may have, maybe that advice will help Alder Jones. Again, it's odd on my screen. It shows up, there's an icon that says she is speaking, but we are not hearing anything. Alder Jones, can you hear us? Right. With that, we'll close the roll. Unless there's objections, we'll leave the roll open to see if we can get any communication from Alder Jones later on. As of now, can the clerk report on the vote?
Sure. As of right now, we have 8 ayes and 5 noes.
Okay. Motion carries. Alder Jones, if you want to text the clerk or have some other way to communicate we would love to hear from you. Moving on to the next item on the agenda. Alder Tate, could you please read the next item?
Certainly. Item 0393-20, direct referral from Mayor Mason requesting to accept federal ESG funds for emergency rental assistance and to enter into agreement with Lutheran Social Services of Wisconsin and Upper Michigan for the purpose of administering the Racine Eviction Prevention Program. Recommendation is to accept the funds and authorize the mayor to enter into an agreement with Lutheran Social Services for the program. Fiscal note, the city will receive $574,928 in CARES Act Emergency Solutions Grant ESG CV funds from the HUD, of which $396,712 shall be used for the purpose of administering the Racine Eviction Prevention Program. There is no city match. That's not a separate consideration, so.
Does anyone want to ask for separate consideration on this item?
I don't believe we have a consent agenda, so we should take a roll.
Oh, we don't have a consent agenda on the item, so we'll have to do it separately. Alder Tate, would you be willing to make a motion?
Move to approve.
The motion to approve, is there a second? If anyone wants to wave a hand so I can call on someone. Alder Taft? Could you say verbally?
Second.
All right, thank you. Alder Tate, if there's no objections, I'd certainly like to hand this over to city staff and ask either Matt Redjick or Vicki Palanek, who I'm unmuting right now, to give a brief description of the program.
Hi,
No
this is
objection.
Vicki Selko. Can you hear me all right?
Yeah.
Yes, great. Thank you. Good evening, members of the council. Thank you, Mayor. Just very briefly, I wanted to offer a little bit of context on these emergency solutions grants and the funds we're receiving from the federal government, just to potentially alleviate any confusion. There was an article in the paper this morning about these funds, and I just want to be clear. The city is receiving 2 rounds of emergency solutions grants, ESG grants, that are from the CARES Act or connected to Congress's action on the coronavirus. So the first round we received notice of in early April, and that is the subject of the funds we're talking about tonight. That round 1 funding was roughly $574,000, and round 2 funding, which is what the Journal-Times covered today, was an additional round of these emergency solution grant funds that totaled $649,000. So we are getting quite a bit of additional emergency solution grant funds. Just as a refresher for those who may not be as familiar with these funds, Emergency Solutions Grant, or ESG funds, are administered at the federal level by HUD, by the Department of Housing and Urban Development, and they're really focused on helping people quickly regain stability in permanent housing after they have experienced a housing crisis or homelessness. And so even though we are receiving those 2 large amounts of funds, $574,000 and $649,000, what is before you tonight is just a small piece of that funding. We certainly recognize that there will be lots of need to have conversations with all of you and with partner organizations about the broader use of these funds and how we might deploy them to address the needs of all the organizations in our community that work on emergency shelter and permanent housing issues, as well as residents in our community who are struggling. What is before you tonight is simply asking for authority to use a portion of these round 1 funds for an immediate need, which is to prevent eviction and homelessness among city residents. So what's before you tonight is a request, and you have a memo from Matt Redjick, who I believe is also available to answer questions on the call. And what we're asking for is the use of $396,000 to go towards a contract to Lutheran Social Services, LSS, to provide eviction prevention assistance. So this would create the Racine Emergency Eviction Prevention Program, which LSS would administer, and it's their estimate and ours that we should, with these funds, be able to provide approximately 2 months of rent and utility payments for approximately 300 city households who have been affected by COVID and who are at immediate risk of homelessness. These are all low-income residents who, as many of you may have heard, I've certainly been talking to a lot of residents and community partners who are very concerned about the potential for evictions in our community. We are asking to deploy a small amount of these funds to hopefully prevent those evictions and ensure that several hundred households in the city have stable housing and are not evicted in the midst of this pandemic. I'm happy to answer questions that anyone might have on it, but I would also direct you to the memo from Matt Redjick, which I think is very helpful, and we ask tonight for your approval for these funds. LSS, just so I can note as well, LSS does have an office in the city. They have worked very well with the Neighborhood Services Department on several other federal funds. They've had no difficulty complying with the federal requirements that come with these ESG funds, and they have assured us that they could quickly get these funds out to use in the community. They anticipate that after agreements are approved, they think they could have this program launched and available to city residents within approximately a week. So with that, I'll stop, and I'm happy to answer any questions or pull Matt in as well if you have questions that I can't field. Thank you.
Thank you. Alder Tate, did you have any questions, or did you want to speak to the motion at all?
Not at this time.
Okay. Alder Peterson?
Yes, fantastic motion. My question would be, I just read in the paper or on news that there's 4.1 million homeowners that are delinquent just this last month. Are there any programs out there? Is there anything going to be put forward, or any federal programs that could help homeowners as well as renters?
I appreciate that question, Alder. Thank you for that. We are certainly looking at what we could do to prevent foreclosure. The city will be receiving other federal funds that would allow us to be used for that. These ESG funds really can't be used for foreclosure prevention. They're very limited in the federal government. They have to be tied to homelessness prevention and eviction prevention, sort of more generally for tenants. But please be assured staff is looking at how can we deploy some of these federal funds for foreclosure relief, and we hope to have a proposal and request to you within the next month or so.
Thank you very much.
You're welcome.
Alder Taft.
Nope, I'm good. Sorry, I must have had my hand still up accidentally.
All right. I see no other hands up. Seeing none. Oh, I'm sorry, Alder Coe.
Yeah, I'm not against this, but I want to know why it costs more to administer this than it does to give to more residents.
Thanks for that question, Alder Coe. Actually, the administrative costs for this are fairly low, but LSS does have to, they do have to hire staff to actually do this. It's quite burdensome administratively. There was a lot that these HUD funds require them to do to comply. For example, every person who applies for these funds has to be entered into a pretty detailed and cumbersome federal database to track their applications. So there's a lot of reporting requirements both for HUD and for the city's use of these funds. So they do need some administrative costs, but I believe, and Matt Regic, if he's on, could speak more directly to that, but he's worked very closely with LSS to really limit those administrative funds. We're giving out 396, or hoping to allocate 396 to them, and I believe a very small portion of that is for LSS administrative costs. Most of this will go directly to tenants who need rent payments and utility payments.
All right, thank you.
You're welcome.
Thank you. Seeing no further discussion, seeing no other hands up, because unmuting everybody didn't work so well last time, I will unmute you one at a time and hopefully get your response. Clerk will call the roll. Oh, and just to be, Alder Glenn's question last time, we are voting on item 0393-20 on the ESG funds. Clerk will call the roll.
Alder Lemke.
Aye.
Alder Coe. Alder Jones.
Alder Jones, are you there?
Aye.
Oh, great. I'm going to come back to you at the last question, too. Next.
Alder Tate.
Alder Tate?
Yes.
Alder Santiago.
Alder Santiago?
Aye.
Alder Levy.
One more time, Alder Levy, sorry.
Aye.
Thank you.
Alder Peterson.
Alder Peterson, one more time.
Aye.
Thank you.
Alder Horton.
Alder Horton?
Aye.
Thank you.
Alder West.
Alder West?
Aye.
Alder Young.
Alder Young?
Aye.
Alderwoman Glenn.
Alder Glenn?
Abstain.
All right.
Alder Perez.
Alder Perez?
Yes.
Alder Taft.
Alder Taft?
Aye.
Alder Mi'kmaq.
Alder Mi'kmaq?
Aye.
Motion carries.
Motion carries 13 yes, 1 abstain.
Alder Jones, how would you like to be recorded on the previous motion, item 0392-20?
Aye.
Thank you very much. Well, that objection will change the record to reflect the vote. We have no other items on the agenda. Alder West, would you like to make a motion to adjourn?
Thank you, Your Honor. Move to adjourn.
Motion to adjourn. Is there a second? Alder Young?
Second.
All in favor of adjournment, please say aye. All those opposed? Motion carries. We are adjourned. Thank you, everyone, for your time this evening.